Hi, this is Dr. Jim Hoven of Ramos Law and your host for Health Matters. Today, it's inflammation that I want to address. You know what? After a trauma, you've heard about swelling, but do you know the causes and the compounding effect of inflammation? Find out now. When was the last time you heard the term swelling and thought of inflammation? If you're in the medical profession, it's probably really common for you and it probably happens all the time. But if you're not, you may not correlate the two. Here's why I want to bring this up today. If you've been in a trauma, let's say accident of any kind, or a slip and fall, a sports injury, anything like that that's happened to you, you're gonna have some swelling and some trauma. If you hit your shoulder, you might notice that there's pain and restricted range of motion in your shoulder. If you whip your neck back, like in whiplash, all of a sudden, you can't turn your neck, you can't turn your head, and you have all kinds of issues going there. That same kind of inflammation can happen in any joint or on any muscle. It doesn't matter where in your body. If your body contacts something hard enough, you're gonna get inflammation. Another sign of swelling is bruising. So if you have something hit your quadricep, for example, your thigh, and it starts to swell up and bruise, another sign of inflammation. But here's what you might not put together. What we take into our bodies in the way of food and in the way of stress and in the way of toxins, they can also generate tons of inflammation. So imagine this, you've been in some sort of traumatic event. You were in a car accident and you're really stiff. In the meantime, prior to the accident and after the accident, your diet's not really clean. And so you eat a lot of sugars, a lot of processed foods, drink a lot of alcohol. All of that is called pro-inflammatory food. So now you have swelling plus a pro-inflammatory diet, and oh, by the way, you're really stressed at work. You got a lot going on. You're going under all kinds of financial pressure. All those things cause mental stress, which causes inflammation. So when you put all of these type of stresses, toxins, and traumas together, you are really, really at danger, if you're going through that, of not having a full recovery or not having as good a recovery as you could for any injury, regardless of if it's trauma-based or not. So here's what we need to do. If you have a trauma-based swelling or inflammation that's localized, in other words, it's in a joint or on an area, it's in your neck, it's in your back, it's in your shoulder, the best thing to do, let's get some ice on there. Take ice, put it on for 10 to 20 minutes at a time. And if you're a heat person, that's fine. You can alternate ice and heat, that's called contrast, where you can put heat on it for 10 and then put ice on it until the ice starts to make your skin feel numb. So you go past cold and it just starts to feel numb. Don't leave it on too long because we don't want a skin injury. But what's going to happen is the heat is going to bring blood flow to that area and the ice is going to push that out. It creates a pump and that will really help to move that swelling in and out of the joint. We don't want to keep that swelling in there. Another thing for localized swelling is to use a specific taping procedure called KINESIO tape. Now the brand I really like is called Rock Tape. It's one that providers put on. You can look up Rock Tape on the internet. You can look up all these different kinds of kinesiology taping and they'll give you guidance of how to use that if you can use it, or find a practitioner that does that. And there's specific techniques to help pull swelling out of joints. So that's what we can do on the exterior. But what about on the inside? Remember, inflammation can be at every cell in your body based on what you eat, your stress loads, and the toxins that are coming inside of you. So to eliminate those or reduce those, try getting rid of sugars. It's hard, I know. I struggle with it every single day. But if we can put sugars away, put those to the side, and then take grains and carbohydrates, move them to the sides as well, that's going to give our body the best chance to move out that inflammation. Also, drink tons of water. It's going to flush your system out. So by stopping sugars or greatly reducing them, by putting in more high quality proteins, and by the way, by moving out the toxins. Stay away from things that you know are bad for you, right? Whether it's drugs and alcohol, those kinds of things are toxic, they're poison, and it causes your body to react through inflammation. So working on the exterior stuff with taping, icing, and working on the interior stuff with diet and getting rid of toxins, that's gonna help you reduce your inflammation and heal faster from your injury, but it's also going to help you be healthier at every level, prevent you from getting some chronic illnesses that you really, really, really don't want. So that's the keys for inflammation. Join me next time for the next cool topic on Health Matters.